Greetings, Naval Information Forces. I am Captain Elizabeth Adriano, and I'm currently serving as your force surgeon. As we've moved through the churn of the last few weeks, engaging COVID-19 as both a Navy and a nation, I have been receiving a lot of emails from all of you out there, and I've noticed the development of a few trends, a few major topics that keep coming up over and over again. And so I thought what I would do is address those concerns in a video so that I can give one clear, concise message to as many of you at one time as possible. And also, I've started an Ask the Doc page on the Naval Information Forces portal, under the Force Surgeon page, where you can address any extra questions that I may not address today on that site, and I will answer you as best and as quickly as I can. So the topics that I would like to consider covering for you today are cleaning and disinfecting, the difference in definitions between a person under investigation with a positive test and presumably diagnostically positive but without a test, the interchangeable at this point definitions of range of restriction of movement, so ROM, quarantine, and self-isolation, which are slightly different, and we'll talk about those later in the video. The concept of testing, who's testing, where are they testing, how long are the tests taking to come back for your sailors. And then last but not least, I'd like to address the stress that a lot of folks are feeling under COVID-19 conditions and how we can help people maintain their mental health and wellness as we move through the next few weeks or even few months, both as a Navy and a nation. So first I'd like to talk about cleaning and disinfecting because I've gotten a lot of questions, a lot of what-ifs. So cleaning and disinfecting of spaces. Number one, I'm going to talk about just the basics. We should all be washing our hands as appropriate. When you do, 20 seconds at a time, use soap and water. We should be using hand sanitizer frequently throughout the course of the day. We should avoid touching surfaces and then touching our faces. That is the most common way that the virus is spread. It's your hands touch a surface, they pick up the virus, and then we all touch our faces. I've noticed I'm pretty bad at this myself. I find myself touching or trying to touch my face frequently throughout the course of the day, and I'm pretty sure you all are no different than I am. So just be mindful of the fact that that is the main way that this is spreading. And then of course there's respiratory droplets, so we want to maintain that 6 feet of distance between us whenever possible. People have asked me, well, what does close contact mean? Because that's one of the risk factors, right? Close contact is specifically defined as less than 6 feet of physical distance for a prolonged period of time. Prolonged is defined as 10 minutes or longer at one given interval. So let's say you have one person, one of your staff members, who tests positive for COVID-19, and that can be either an FDA test or a doctor or a provider diagnoses you based on symptoms and screening, which we'll talk about in a few minutes. So if that person is in their own office or in a cubicle that's closed off from the rest of the cubicle farm in your area, you don't have to send anybody else home on ROM, and you don't have to clean the entire building. What you do need to do is allow that space to have plenty of airflow through it for at least 24 hours, and then it needs to be cleaned with soap and water, wherever spaces will tolerate soap and water, and then with a disinfectant. This can be accomplished by your cleaning crew if you've got one on board. If you have a person who has been diagnosed with COVID and they're in one of those like 4 or 6 person cubicles, that's a little more challenging because those people have probably been in less than 6 feet of contact with each other for more than 10 minutes throughout the course of their workspace and their day. And so it would be very reasonable to send those folks home on ROM for 14 days while you're kind of awaiting the results of the test from your individual. So that takes care of cleaning. Now, one of the what-if questions I've gotten is, well, what if one of your sanitation workers comes down with a positive diagnosis and they've been all throughout your building? What do you do? Well, that actually happened at one of our facilities, and it's very reasonable, and this facility did shut down operations and send everybody home. They brought in a cleaning crew. They cleaned and disinfected the entire space, the entire building, and then once that was done, they were able to call everybody back into work. And that resulted in about 24 to 48 hours where there was nobody in the building and people were teleworking from home. That's going to be a very unusual circumstance, but I feel like I need to address it because it's already happened once. As far as a person or patient under investigation and the concept of restriction of movement, quarantine, and self-isolation, a person or patient under investigation is defined as an individual who has presented to medical and who has either been shown to have symptoms that warrant concern and meets some of the screening risk questionnaire. That includes they've traveled to a high-risk country, they have been in close contact with a person who is a known positive COVID-19 patient, to name two. If that person is awaiting an FDA-approved test or they have been diagnosed as COVID by their doctor, they are now a person under investigation. There are certain rules that apply to both of those categories of patient for return to work purposes. If you have had an FDA-approved test and you are positive, you may return to work if the following three criteria are met. Number one, you've been without a fever for at least 3 days. That includes without using any fever-reducing medications, such as Motrin, ibuprofen, Aleve, naproxen, or Tylenol. You must have improvement in your respiratory symptoms if you had those symptoms to begin with. That would include a cough or shortness of breath. And then you must have 2 negative tests for COVID that have been obtained within 24 hours of each other. So that takes care of the positive tested people. The folks that have been diagnosed without a test, but they meet risk factor criteria, they just didn't get the test, they may return to work when the following 3 criteria are met. Again, they have to be without a fever for 3 days. They must have improvement in their respiratory symptoms, and it must be at least 7 days from the onset of their first symptoms. So that is why and how those 2 groups of people may return to work per the most recent BUMED return to work guidelines. Those are dated 27 March. Today is the 2nd of April, so those are the most recent ones that we have. I have heard that those will be updated sometime within the next few days. I will make sure to post those to the Force Surgeon portal page, and I will make sure I get an email out to all of you all notifying when that has occurred. So that describes the return to work policy. Now there's the third group of people who may have influenza-like illness or ILI symptoms. That may be a fever, cough, headaches, muscle aches and pains, otherwise known as myalgias, or fatigue. If those folks have not traveled to a foreign country, have not been in contact with either a patient under investigation or with a COVID-19 known positive patient, they do not need to be tested. They are not a PUI. They need to just stay home like you would normally during the normal cold and flu season until your symptoms resolve. That caveat to change your mind about that is if any of those parameters change or your symptoms worsen, then I recommend you contact your local medical to find out whether or not they want you to come in and be tested. The next topic I want to talk about is testing. So a lot of folks have said, why is it taking so long for me to get my sailors' test results back? Part of the reason for that is for a while at the beginning when all of this first started to gain both national and the attention of Navy Medical was that we didn't really have testing for COVID-19. Once the FDA approved testing and the CDC said yes, there were a lot of tests that were promulgated and put out to a lot of different facilities nationwide. What that meant was that, of course, there were a lot more tests being conducted, which meant a lot more tests were being sent to those labs. That created a backlog of tests for these labs because there's only so many tests that can be processed within a 24-hour period. In addition, most of those labs require mail-out. So depending on where you're at in the world, your sailor may get their test result back in 3 to 5 days, or it may take as long as 10 to 14 days before your sailor's test results are known. For many of your sailors, at that point, they're already approaching meeting the parameters for when they can return to work, depending on whether or not they had an FDA-approved test or did not. I've had questions also about the reliability of the test. So the most recent data that we have about the current COVID-19 testing is that for 60% of patients who have COVID, they will test positive for the disease. For 90% of the folks who don't have it, they will test negative. So there's a margin of error for both of those testing categories. That brings about the topic of, or the concern for, asymptomatic spread. So the truth is that until your viral load hits a certain volume, you may get a test, be a carrier of the virus, and still have that test be resulted as negative because there just wasn't enough to pop that test into the positive range. So there are probably many people walking around who are carrying the virus, who are not symptomatic, who are definitely shedding the virus. They may then develop symptoms, but still not have enough of the load to test positive. So all of those are factors that just need to be considered as you are taking care of your folks and considering restriction of movement for folks, and considering this concept of sequestration prior to sending folks into an area where you know they may or may not be putting others at risk. And if you have any questions very specifically about that, please don't hesitate to reach out, because that is also a concept for mission assurance that is consistently evolving and has evolved rapidly over just the last 72 hours. The screening procedures that we've put in place per the most recent FRAGO include that everybody must have a box of face masks, hand sanitizer, and thermometers. Well, the face masks are not for the screeners. That's been one of the more common questions that I've received. They are to be used by any person that presents to the screeners that is positive for any of those questions. None of us have non-contact thermometers thus far, or I should say very few of us do. So you may still conduct your screening without the temperature check, and we are expected to receive a volume shipment through U.S. Fleet Forces that we'll be promulgating as quickly as we get them out to the domain. So more to follow on that. And then last but definitely not least, I want to talk about the concept of mental health and wellness and the stress that a lot of your folks, and maybe you, are feeling as a result of COVID-19. Our entire way of life and doing business and relating to each other has been drastically altered over the last few weeks. We have stop movement orders that have been sent down from DOD, and we also have many state governors that have put stop movement orders in place to restrict people from being in gatherings of more than a certain number of people and being in places where they are more at risk to pass or receive the virus. This puts a lot of stress both on adults and on children. So first of all, I would encourage everybody to continue to engage in the practices that we know lead to good health, so you can maintain excellent health throughout this to the best of your ability. Get enough sleep, eat the right foods, consume enough water so you're hydrating adequately. Make sure that you are expressing gratitude to the people that are around you for all of the things that we're doing as a society to help combat the spread of this illness. Take time with your kids. They're very stressed at this point too. Their lives have been disrupted. There are a lot of your sailors that are struggling with how to find childcare, how to continue their children's education when their kids are not in school anymore. This is putting a lot of stress on families as a unit, as well as your mission-capable unit. And it's very challenging because our people are our most valuable resource, and it's vital that we keep the total force healthy. And we wear the cloth of our nation, and we still have a mission that needs to be met. And so finding that balance is very challenging, and that's putting a lot of stress on all of us. So take care of each other. Seek mental health resources if and when you need to, but continue to rely on the people that are in your realm so that we can be taking good care of each other. Thank you so much for spending this time with me. I know I've gone a little over 10 minutes. I really appreciate your patience. I hope this has been worthwhile. I'm going to continue to communicate as effectively as I know how as we continue to go through this churn of COVID-19. And if there are other questions that you have, again, please use the Ask the Doc option on the portal page. And I will be hosting next Tuesday on the 7th of April at 1300 Eastern Time a Facebook Live town hall that I would encourage you to participate in if you still have questions. Thank you so much. I appreciate everyone rolling with the punches, and I am honored to serve as your force surgeon. Stay well, be healthy, and have a great day.